Hello, my name's Kevin Hall. I'd like to tell you about the course that I'm running called Evidence-Based Soft Tissue Skills. It's a 2-day course with a large practical component that covers assessment and treatment techniques, and also a large theoretical component that explains why and how soft tissue becomes dysfunctional and looks at the current evidence base relating to its management. Now, I think there are two main reasons why soft tissue is important to us. Firstly, shortened muscles can change the way in which a joint moves. In the shoulder girdle, for example, stiffness or loss of range through some of the rotator cuff muscles can alter joint mechanics and lead to subacromial pathology like impingement. There are lots of other examples of this in other regions of the body, and we'll be looking at how to identify and treat these problems in much more depth. The second reason why soft tissue is important is that it can be a potent source of pain. For this reason, we need to know how to identify and to treat it. There's also a growing body of evidence that suggests that, for example, trigger points play a major role in chronic pain syndromes, and we'll look at some of the pain physiology that explains why. I'm hoping to expand your thinking on this point because I think it's a really exciting area for us to consider and has major implications for our patients. So now to the aims of the course. There are 3 key aims which revolve around the core skills and knowledge I want you to go away with. They are assessment, treatment, and integration. So for assessment, when we cover each body region, we'll learn through careful palpation and assessment techniques how to identify soft tissue dysfunction. I'll show you where to look for common sites of restriction and trigger point formation, and the whole time we'll be thinking about our anatomy. So focus on what we're feeling, what's under our fingers, and what those structures do. So by the end, I want you to feel confident in the differential diagnosis of soft tissue dysfunction. So once we've identified a dysfunction in soft tissue, we need to know how to treat it. So the second aim of the course is to teach you a range of treatment techniques that will enable you to treat what you've found. The techniques we'll cover will include trigger point release, muscle energy techniques, positional release, myofascial release, as well as more traditional massage techniques such as effleurage compressions and dermal techniques. We'll also look at integrating these techniques into the most effective treatment strategy possible. We'll spend some time thinking about what to use, when and why. The aim being that you leave the course with a clear understanding of why you might choose one technique over another. The third aim is integration. So what I mean by integration is looking at the big picture. So thinking about why. Why does this muscle hurt? Why does this structure hurt? Why has this trigger point formed? And we'll be looking at the role of postural types, muscle imbalance, the role of stress and breathing dysfunction. We'll also consider other aspects of the management strategy of common pathologies like back pain, neck pain, shoulder impingement, patellofemoral pain, and consider other aspects of the management strategy, the other things that we need to think about and include when we're treating our patients. So basically my aims for the course are that you become far more skilled in your palpation during assessment, that you have an expanded range of treatment possibilities, and that you're more selective in your application of these techniques. You will have an increased knowledge base to underpin your practice, and I also hope that you find the course exciting, stimulating, and I look forward to welcoming you.